Let's talk about kidney failure in Nigeria because right now, as it is, I would say kidney failure is one of the major diseases that most Nigerians are suffering right now, both young, very young, and old. And it doesn't seem to stop. It just seems like every day a new set of people are coming up with this particular disease. And my major problem right now is the fact that I see a lot of medical practitioners online talking about it, and they don't really tell people the key things they need to know about kidney failure. They don't tell you the leading causes of this kidney failure. They don't tell you things you could do to catch it on time before it becomes severe. They don't talk about these things. They just keep talking about avoid this, don't eat that. But they're not telling you the key things you need to know. So today, I've decided to make a video concerning this particular disease. And disclaimer, I am not a medical practitioner. I am not a professional in any medical field. I am not in any way a medical practitioner, but I have taken my time to study about this particular disease. And because I have someone currently going through it, and I've taken my time to study about it, and I can at least be able to say a few things concerning this particular disease. So let's go. Did you know that it could be damaging your kidney for years and you won't even know it? You wouldn't feel pain, you would feel completely fine, and you won't even know you're going through kidney failure until it becomes severe and needs an urgent medical attention. One of the leading causes of kidney damage is something millions of people are already living with and they don't even know it. Diabetes and uncontrolled high blood pressure. Yes, uncontrolled high blood pressure and diabetes. These are the leading causes of kidney damage. What causes kidney failure? Now let's start with the biggest culprit here, which is diabetes. Diabetes can cause the tiny blood vessels inside your kidney to damage over time. When blood sugar stays high for years, the kidneys are forced to work harder and the filtering ability gradually deteriorates. Your kidneys have millions of tiny blood vessels that filter your blood. And when there is persistent high blood pressure, these vessels can be affected. Persistent high blood pressure can damage these vessels, thereby reducing how well your kidneys can function. And here is the dangerous part. Diabetes and hypertension can both cause kidney damage without any symptoms at the early stage. Other causes of kidney failure may include kidney infections, autoimmune diseases, urinary tract obstructions, medication abuse. This one is not commonly said. Medication abuse. And sometimes it could be inherited. Some of these diseases are hereditary. I also read that high blood pressure, diabetes, kidney failure could be inherited. Now, let's move to how to dictate if your kidney is fine or not. Now, the quickest way to know if your kidney is good or not is by running a test. Please do not wait until you start feeling the symptoms, because sometimes you won't even see the symptoms until it becomes severe. You should run a blood test, you should run a urine test. These are the quickest ways to detect if your kidneys are fine or not. When you go to these labs for tests, you can ask your doctor about serum creatine. I think it helps them assess how well your kidney is functioning. You can also check your high blood pressure and diabetes, because these are the leading causes of kidney failure. Urine albumin. I think this helps in checking if there are little amounts of protein leaking into your urine, because these are also early signs of kidney failure. What are the warning signs of kidney failure? Kidney failure can be silent at the early stages, but as it progresses, you start noticing things like swelling on your feet, your ankles, and even your face. People see you and they think, oh, you're adding weight, your face is getting chubbier. They won't know these are the signs of these are the signs of kidney failure. Yeah, you start noticing swelling face, swelling stomach, swelling feet, and all of that. And secondly, changes in how often you urinate. You can also have foamy urine, blood in your urine. When you start noticing that your urine is foaming, like when you pour out beer inside a cup and it starts foaming, or when you pour out some, yeah, that is an early sign. That is a sign of kidney failure. If you detect things like this, please rush to the hospital. These are the early signs. Itching, constant itching, muscle cramping. Yeah, muscle cramping is part of it. These are the early signs of kidney failure. When you start noticing this sudden swell on your feet is swelling, your ankle, shortness of breath. Yeah, you start having shortness of breath. Shortness of breath is part of it. Please go to the hospital. These are signs of kidney failure. Some people see these things and they ignore it. They assume it to be normal without even knowing what their kidney is going through until it becomes so severely damaged that curing it or taking care of it becomes a problem. Please remember, having these symptoms does not automatically mean that you have kidney failure. And not having these symptoms does also not automatically mean that your kidneys are fine. So the best way you can know if your kidney is fine or not is by simply going for tests. Go for checkup. Please, my dear Nigerians, make it a routine, make it a cultural thing to always go for checkup at least 2 to 3 times a year. How do you protect your kidneys? Here is the good news. There are some things you could do to protect your kidneys from getting damaged. Please keep your blood pressure under control. Always run your blood pressure test. Keep it under control. If you have diabetes, please work with your doctor to make sure your blood sugar is being controlled. Keep a healthy weight. Don't be obese. That one is difficult to do, but keep a healthy weight. Eat vegetables, eat whole food. Stop eating too much processed food. These are also part of the problem. Avoid too much intake of salt. Some of you, you boil rice, you add salt. You boil your stew, you add salt. You boil your chicken, you add salt. You fry your plantain, you add salt. All of these things in one sitting, you will consume them. That is not healthy for your kidney. That is too much sodium. Even inside the same meal, you have hot dog, which is sausage. You have it inside. That's too much sodium for your body to process at once. Stop eating too much processed food. Drink water. Drink appropriate amounts of water. Don't drink excessive water thinking you need to flush your kidney. I don't know about that. I'm not a medical practitioner. But don't do everything at moderation. Moderation is key. Do you understand? Here are things to avoid. And please be careful with medications. Excessive intake of some certain painkillers are also part of the causes of kidney failures, particularly NSAIDs, especially in people that already have kidney disease, heart problems, etc. Too much consumption of this kind of painkillers, ibuprofen, diclofenac, can also cause more problems for you. Don't routinely take painkillers without knowing if they are appropriate for you or not. And don't also assume that because something is labeled natural or herbal, automatically means it is healthy for your kidney. And to end this, your kidneys do not have to scream before you pay attention to them. Don't wait for symptoms to appear before you pay attention to them. Please get your kidney function tests done to know if your kidney is fine or not, especially if you're diabetic, if you're struggling with high blood pressure, or you have any other risks. Please always check yourself. Always try to contact your doctor to know the right thing to do and what not to do. And remember, it is easier to prevent it than paying for dialysis. Thank you very much. Please share this video so that others would learn. Thank you. Bye.